Cancer is a dangerous disease that is one of the leading causes of death worldwide. Cancer mortality can be reduced if cases are detected and treated early. Here are the most common signs you need to know about cancer. If you suspect any of these signs to be affecting you, then make sure to make an appointment with a qualified healthcare provider with your concerns. Number 1. Shortness of breath. Shortness of breath is a sign of lung cancer. However, if you are noticing that you are more often out of breath than what is considered normal, then you may want to get a checkup from your doctor. Number 2. Unusual coughing. Coughing isn't exclusive to smokers or to people with a cold or allergies. A persistent cough is an early sign of lung cancer. If you don't have any other related symptoms, such as a stuffy nose or fever, the cough probably isn't due to a virus or infection. Coughing accompanied with bloody mucus is also associated with lung cancer. Number 3. Swollen lymph nodes or lumps on the neck, underarm, or groin. Enlarged lymph nodes indicate changes in the lymphatic system, which can be a sign of cancer. Number 4. Pain in the bones. If you are suffering from severe pain in the bones or any other part of your back during any time of the day or night, then you must need to pay attention to this serious symptom and consult with a doctor. Number 5. Frequent fevers or infections. These can be signs of leukemia, a cancer of the blood cells that starts in the bone marrow. Leukemia causes the marrow to produce abnormal white blood cells, sapping your body's infection-fighting capabilities. Your doctor should take your medical history and give you a physical exam to check on the cause. Number 6. Weakness and fatigue. Excessive fatigue or weakness is your body's way of telling you that something just isn't right. It may be an important symptom as cancer cell grows. If fatigue is affecting your daily life, talk to your doctor. Number 7. Difficulty swallowing. Trouble swallowing is most commonly associated with esophageal or throat cancer and is sometimes one of the first signs of lung cancer too. Number 8. Changes in nails. Changes in the fingernails can also be a symptom of different kinds of cancers. Pale and white nails can be a symptom of liver cancer. Black or brown dot under the nails indicates the skin cancer. Number 9. Changes in bowel movements. Anything that appears out of the ordinary regarding bowel movements and lasts more than 2 days could be cause for cancer. Finding blood in your stools could be a sign of colon cancer, and it should be evaluated by a medical professional. Number 10. Sores that do not heal. Skin cancers may bleed and look like sores that don't heal. A long-lasting sore in the mouth could be an oral cancer. This should be dealt with right away, especially in people who smoke, chew tobacco, or often drink alcohol. Sores on the penis or vagina may either be signs of infection or an early cancer and should be seen by a health professional. How to prevent cancer. If you're concerned about cancer prevention, take comfort in the fact that some simple lifestyle changes can make a big difference. Consider these cancer prevention tips. Filter your tap water. You'll reduce your exposure to known or suspected carcinogens and hormone-disrupting chemicals. Home-filtered tap water is safer than bottled water, whose quality often is not higher, and in some cases is worse than that of municipal sources. According to a study by the Environmental Working Group, store water in stainless steel or glass to avoid chemical contaminants such as BPA that can leach from plastic bottles. Eat clean foods. The President's Cancer Panel recommends buying meat free of antibiotics and added hormones, which are suspected of causing endocrine problems, including cancer. The report also advises that you purchase produce grown without pesticides and wash conventionally grown food thoroughly to remove residues. Protect yourself from the sun. Skin cancer is one of the most common kinds of cancer, so avoid midday sun. Stay out of the sun between 10 a.m. and 4 p.m., when the sun's rays are strongest. When you're outdoors, stay in the shade as much as possible. Sunglasses and a broad-brimmed hat help too. Wear tightly woven, loose-fitting clothing that covers as much of your skin as possible. Opt for bright or dark colors, which reflect more ultraviolet radiation than pastels or bleached cotton. Use generous amounts of sunscreen when you're outdoors and reapply often. Load up on green greens. Next time you're choosing salad fixings, reach for the darkest varieties. The chlorophyll that gives them their color is loaded with magnesium, which some large studies have found lowers the risk of colon cancer in women. Just a half cup of cooked spinach provides 75 milligrams of magnesium, 20% of the daily value. Avoid unnecessary scans. CT scans are a great diagnostic tool, but they deliver much more radiation than X-rays and may be overused, says Barton Kamen, MD, PhD, Chief Medical Officer for the Leukemia and Lymphoma Society. In fact, researchers suggest that 1/3 of CT scans could be unnecessary. High doses of radiation can trigger leukemia, so make sure scans are not repeated if you see multiple doctors, and ask if another test, such as an ultrasound or MRI, could substitute. Head off cell phone risks. Use your cell phone only for short calls or texts, or use a hands-free device that keeps the phone and the radio frequency energy it emits away from your head. The point is more to preempt any risk than to protect against a proven danger. Evidence that cell phones increase brain cancer risk is neither consistent nor conclusive, says the President's Cancer Panel report. Don't use tobacco. Using any type of tobacco puts you on a collision course with cancer. Smoking has been linked to various types of cancer, including cancer of the lung, mouth, throat, larynx, pancreas, bladder, cervix and kidney. Avoiding tobacco, or deciding to stop using it, is one of the most important health decisions you can make. It's also an important part of cancer prevention. If you need help quitting tobacco, ask your doctor about stop smoking products and other strategies for quitting. Maintain a healthy weight and be physically active. Maintaining a healthy weight might lower the risk of various types of cancer, including cancer of the breast, prostate, lung, colon and kidney. Get regular medical care. Regular self-exams and screenings for various types of cancers, such as cancer of the skin, colon, cervix and breast, can increase your chances of discovering cancer early, when treatment is most likely to be successful. Ask your doctor about the best cancer screening schedule for you. Take cancer prevention into your own hands. Starting today, the rewards will last a lifetime. If you like the video, give it a thumbs up and share it with friends. For more health tips and recipes, subscribe to the channel.